Hi, today I would like to draw your attention to a recently published paper on the effectiveness of stem cell injections in knee osteoarthritis. The reason for discussing this paper is that patients who come to me for this procedure ask me for evidence supporting this mode of treatment. In recent years, many patients, both young and old, are interested in stem cell therapy. They find this treatment extremely attractive because of several reasons. Many of them don't want to undergo the trauma of a knee replacement, while others consider themselves maybe rightfully also as too young for a knee replacement. Then others are worried about the unhappy results in their circle of friends or relatives after a knee replacement. So doctors like me need to assure our patients that indeed stem cell therapy is effective in treating osteoarthritis. And that is the purpose of reviewing this paper. This paper has been published in the Journal of Arthritis Research and Therapy in August 2023. This is the paper. It has been published in the Journal of Arthritis Research and Therapy in August 2023. The title of this paper is Effect of Intra-Knee Injection of Autologous Adipose Stem Cells or Mesenchymal Vascular Components on Short-Term Outcomes in Patients with Knee Osteoarthritis. An updated meta-analysis of randomized controlled trials. The authors are Yang and Zibin Lin. They are from the Ningxia Medical School in China. So let me clarify what a meta-analysis is. A meta-analysis is a quantitative formal epidemiological study used to systematically assess the results of previous research to derive conclusions about that body of research. Typically, but not necessarily, the study is based on randomized controlled clinical trials. That means the authors collect a pool of previous research papers on the particular topic, in this case, the effectiveness of stem cells in knee arthritis. They then analyze that research for its accuracy and then come out with their own conclusions in their paper. So this is that kind of a paper, that it is a meta-analysis, and its level of evidence would be quite high because it has included analysis of randomized controlled trials, RCT as they are known as. Randomized controlled studies are the top tier of research, and therefore you can draw some sound results from them. So this is a meta-analysis of randomized controlled trials, and it would be at the same level, that is at the top of the evidence pyramid. The lead author, Dr. Yang, MD of Ningxia Medical University in China, writes that there has been a growing fascination with the potential use of stem cells as a therapeutic approach for treating knee osteoarthritis. Among the various types of stem cells, mesenchymal stem cells, MSCs, have shown great promise in restoring damaged articular cartilage and in slowing the progression of knee osteoarthritis. Yang and colleagues report their meta-analysis of 7 RCTs for efficacy of single and multiple intra-articular injections with abdominal sourced adipose-derived stem cells or adipose-derived stromal vascular fraction, representing the commonly used source of mesenchymal stem cells. Adipose-derived stromal vascular fraction, that is, the stromal vascular fraction is a preparation made from fat. I harvest fat and process it to prepare stromal vascular fraction, and this is what I inject along with PRP drawn from your blood, and this combination is called as platelet-rich stroma or PRS. Adipose-derived SVF is a combination of extracellular matrix components with varying types of cells capable of tissue repair and angiogenesis. ASCs, adipose-derived stem cells, are pluripotent and they are capable of differentiating into multiple cell types and they can also self-renew. So in this study, visual analog scale and WOMAC scores, this is a functional score, significantly improved in treatment arms compared with controls at both 6 and 12 months. However, subgroup analysis indicated the VAS improvement was greater only at 6 months for the AD-SVF than the ASC group. Only for the AD-SVF, that is SVF is more potent than stem cells alone because SVF contains all the ingredients required to create or regenerate cartilage. SVF has got extracellular matrix, it has got the chemicals, that is the growth factors, and it has also got the various types of cells. Among them are mesenchymal stem cells, then immunological stem cells, macrophages, and vascular endothelial cells, many cells. So this mixture has got all the ingredients to construct a building like a house. So SVF contains extracellular matrix, which is the groundwork of cartilage. Then it has got the building blocks and it has got the chemicals. So in this study, the results were better at 6 months in the stromal vascular fraction than the ASC group. Is that those who have a single injection, their scores were improved at 6 months. But at 12 months, only the adipose-derived stromal vascular fraction for both single and multiple injections proved efficacious. I performed this stromal vascular fraction, I combine it with PRP and make PRS, and that is what I inject into the joint. So this study says that adipose-derived stromal vascular fraction was efficacious at 6 months and more importantly at 12 months. So even after a year, you will have improvement. MRI tests were done, MRI scans. I performed 3 Tesla MRI scans. MRI assessment revealed significant improvement in cartilage status in 4 out of 6 studies at both 6 months and 12 months, with none in the long-term 5-year study. Injections of MSCs in general improved pain and function in knee osteoarthritis at 6 and 12 months. Subgroup analysis indicate single and multiple injections are effective for pain but are variable in functional efficacy. MRI functional status improved in some studies. What they are saying is that mesenchymal cells are effective in repairing cartilage. Mesenchymal cells are abundantly available. In adults, the 2 common sources of mesenchymal cells are bone marrow and fat. I started using fat to treat knee osteoarthritis from October 2018 and I've been continuing in this practice. My patients are finding the treatment to be quite effective. Let's see the result. The researchers collected and analyzed basic publication details, patient demographic information, the type and number of injections used, the scale used to determine outcomes, whole organ MRI scores, and the magnetic resonance observation of cartilage repair tissue. The primary outcomes were patient pain and functional scores. The analysis included 7 randomized controlled trials. According to the researchers, patients who received 1 or more injections demonstrated short-term pain relief and function. The p-value was 0.0001. So this is very significant p-value. In addition, MRI results show that patients receiving injections had improved cartilage conditions compared with the patient in the control group. The p-value was 0.0001, even more. So the authors write that in osteoarthritis of the knee, single or multiple intra-articular injections of autologous ASCs or ADSF have shown significant pain improvement and safety in the short term in the absence of adjuvant therapy. Young and colleagues wrote that significant improvements in cartilage status were also shown on MRI. They recommend a larger sample size of randomized controlled trials for direct comparison of the difference in effect between single and multiple injections. So, in conclusion, MSC therapy represents a promising therapy for knee osteoarthritis, but requires more robust studies to standardize treatment protocols in order to predict symptomatic and cartilage benefit. So, I have put up testimonials and evidence of stem cell treatment in my YouTube channel, which is linked up here, Madras Joint Replacement Center. You can refer it over here. I have reported on patients from 2015, my first few patients. One of the first few patients was an elderly gentleman who was 80 years old at that time. He came back a year and a half later and had reported significant improvement. He continues to climb and do trekking. Another gentleman I reported with the MRI scans before and nearly a year and a half late after the procedure. In this patient, the second patient who I have shown here, and it has been reported here, there is MRI evidence of cartilage repair and decrease in the bone marrow edema. You can see that testimonial published up here. Other patients also in my know are quite comfortable for several years after this MSC treatment. You can check out their testimonials in my YouTube channel, and you can also refer to my website www.orthobiologicsurgeryindia.com. These days I mainly use fat from the thigh or in rare cases from the abdomen to harvest fatty tissue. I prepare it in the operating theatre and inject it into both knees or one knee under ultrasound guidance. You see one procedure of an ultrasound guided knee injection over here. Hope this information is of interest and has shored up or increased your confidence in seeking out this treatment. If you are convinced by this treatment, then you are welcome to consult me in Chennai. If you want to see more research and more papers, you can check out my YouTube channel. If you are desirous of recommending this treatment to your friends or relatives, feel free to do so. If you found this paper informative, then if you want to remain abreast of new papers whenever they come out, then subscribe to my YouTube channel link down below. Thanks for watching. See you in the next video. Bye.